Hello, this is Dr. Do again. This video is still on alphabetic disorder problems on letter S. Today I'm going to talk about a group of disease called somatic disorders. Actually, this is it's a psychological condition, but it's real disease. It's not like a factitious or malingering. This somatic disorder, it's actually based on the definition is the psychological symptoms transform into the physiological or physiological conditions. It's a disease like even though there's no evidence, no abnormality during the physical exam, but it's a mental illness. It's a mental illness caused this presentation as the body physiological conditions. It is quite common actually. Sometimes a lot of systemic diseases, when the systemic disease is impaired with this mental conditions, for example, the autoimmune disease, sometimes lupus can associate with the neurological conditions, and patients will present as somatic disorder, just feel the disease, regardless, you do the test, you do the exam, nothing positive, but still the disease is there. So this is about the group of because the presentation is so wide actually, it's a comprehensive cover. Really, it's not a specific disease, but it can be anything. So this is let me just bring up the emergency situation with this somatic disorders. Actually, probably it's not. I couldn't think of anything really emergency associated with this somatic disorders, unless there's some other conditions like the malingering or factitious disease. For example, the factitious disease patient seeking the sick role and then use some medications. For example, insulin causes hypoglycemia. So if that's the case, that's emergency. But in terms of somatic disorder, probably it's not an emergency situation. And because it is so subtle. So this is a introduce of the somatic disorders. In terms of presentations, could be variety. Headache, for example, and abdominal pain, and joint pain. Even though during the physical examination, you couldn't find any positive, or lab test, there's nothing there. But it's different from the factitious disease or the malingering, because those diseases, there's a sacral, primary or secondary gain. This is hard to explain in the language. I'll give you an example. The factitious disease just try to draw attention to have the sacral, to get the care. Like Munchausen's, that's the other name. And those occur like, for example, probably not common nowadays, but the common example in the medical field is working in the health system, inject some, for example, take some thyroid medication, cause this symptom of the hypothyroidism, like the heartbeat faster and exactly like the hypothyroidism. But during the exam, there's a way to find out whether it is the hypothyroidism from the thyroid or whether it's from the taking the medication of thyroid hormone, exogenous coming. So if that's the case, the diagnosis can tell. Those people, they just try to get signal, get attention, and that's called factitious. And the malingering is the second level of sacral. What that means is get some benefit. For example, if the patient doing this for the purpose of either financial gain or take some sick leaves, etc., so that's belong different. Those people are normal. Physiologically, psychologically, probably it's normal, but just have this kind of symptom, produce the symptoms on purposely or intentionally to produce these symptoms. Even though it's not common, but it happens sometimes, either for the patient themselves or for the children. That's the sacral. And this somatic disorder, it's a disease, it's a mental illness. because the symptoms could be variety. Those patients tend to see many physicians and without any positive test result, without any record of positive physical examination, and also probably their chart might be very thick, or this is for medical field actually, but for those people, they tend to willingly to be treated. I think, for example, there is a patient from the lupus, had the long-term lupus with altered, not automental status, but the psychological psychologically affected by this lupus caused brain or nerve or psychological damage. So feel bloating, just regardless what you tell, what you do, you use medication to treat bloating, doesn't feel better. You do anything, you do the test, and nothing there. There's no obstruction, there's no bacterial infection, there's no diarrhea, no constipation, but just to feel the bloating, like the abdominal feel fullness and pain. Regardless what you test, regardless what you do, it's still there. So if that's the case, and the patient wants you to have a surgery. So if that's the case, it's really difficult to handle. You cannot just say, I cannot give you a surgery, or you cannot say, I'll give you a surgery. So this kind of somatic disorder, it is the disease. So in terms of for those patients, they cannot help themselves. And so this is really the challenge for physicians. Like the case I presented here. There was one case, and really following the patients, I think that's a couple decades ago, many decades ago, there's a report. So then opened up because really the patient asked for, because she feel painful, she just cannot make it feel better regardless what we do, what the physician do. So then the physician without anything, without any measure, just following the patient's will, so did the surgery, performed the surgery, but open up the intestine, the stomach, the liver, every organ just as normal. I couldn't be more normal. You know what I mean? So this kind of condition is really, sometimes it's vigorous. So and the treatment was probably not going to improve, and later on this patient will develop other symptoms, like for example joint pain or headache or another abdominal pain. So this is just going on and going. I think the fundamental is probably need to do the behavior cognitional treatment or with the help of medication. So this is just another category of disease here. In terms of the message for this video, take-home message for this video is, if you or your family had this kind of long-term systemic disease, for example, lupus I mentioned, or other disease, and with the psychological or altered mental status, or older people develop this psychological abnormality, and they complain something not comfortable, I think talk to the physician or probably do the cognitive and behavior assessment, make sure it is a true disease. But on top of that, of course, if this emergency, older people has to treat it as true physical diseases, and unless there's a strong evidence exclude. So this is because I am thinking about this case I read a long time ago, so I just present here. Hope it triggered your interest and to search more about this somatic disorder and also some systemic disease associated with the somatic disorder. Of course, in terms of diagnosis, there's a criteria, in terms of treatment, that kind of challenge to the physicians. But I'm going to stop here, and thank you for watching. I will see you next time.